Dr. Prabhakar Mallya, based in Udupi, India. I'm a postgraduate lecturer in the University of South Wales for diabetes and preventive cardiovascular medicine. Today, I'm going to talk about hypertension or increased blood pressure. So what is blood pressure? When heart beats every time, it pumps blood into the blood vessels. It creates a pressure against the blood vessel walls. That is called blood pressure. When the blood pressure increases in a long term, persistent increase in the blood pressure is called hypertension. So what is normal? What normal blood pressure is? We measure it as 120 over 80. It's called also 120 over 80 millimeters of mercury. So any blood pressure which is more than 140 over 80 is called hypertension. So what are the risks? There are some inherent risks. One is age, second is family history, third is our food intake, added salt, processed food intake, or taking lot of fatty food, smoking, alcohol, and stress. These are all the risk factors which can increase the blood pressure. Another thing is our defective or unhealthy lifestyle. Most of the time we are now sitting quietly, not going for active exercises. That is the main cause of getting blood pressure, hypertension. So what are the symptoms? The first symptom usually after a persistent hypertension is headache, buzzing in the ears, nausea, vomiting. Sometimes there may not be any symptoms. It's actually called a silent killer. It can cause heart failure, stroke, heart attack, all these things. They will come when the blood pressure goes very high over a period and cause a lot of morbidity and mortality. So how to prevent it? Prevention of blood pressure is through healthy lifestyles. You be active, go for exercises every day. A fit heart can pump blood into the blood vessels without any issues. Second thing is reduce the salt intake. And dietary, there is another approach called dietary approach to stop hypertension, or DASH, or Mediterranean diet, is taking lot of fruits, vegetables, and pulses. On these things you can prevent blood pressure development. Then stopping processed food intake, reducing your fat intake, reducing stress by meditation or breathing exercise, or called pranayama, monitoring your blood pressure regularly. Most of the time they go to doctors for controlling their blood pressure, or go to a hospital where a nurse can check the blood pressure. But you can do it at home. You can do it, it's called self-monitoring of the blood pressure. There are blood pressure monitors are available. You can buy them and monitor the blood pressure. They are good. And regularly monitoring the blood pressure is the key to prevent hypertension. Then if you are on medications, take them regularly, go for follow-up with the doctors, follow his advice. And I can say in the last, keeping yourself fit and active is the long-term goal to prevent any complications of hypertension. So keep yourself fit, healthy, eat healthy, stay active. Thank you. Thank you very much.